a second. We're live now, Earl, so I will pop you up.
Town hall meeting featuring our United States representative from Minnesota's 2nd Congressional District, Angie Craig. This is Representative Craig's 19th town hall. I am Earl Wyman. I'm your moderator. I'm a social studies teacher at Northfield Middle School. This year will be my 28th year teaching 7th grade social studies in Northfield, Minnesota. Today, along with Angie Craig, or Representative Craig, we are joined by Andy Slavitt, who Ms. Craig will introduce to you shortly. Before we begin, allow me to lay out a few guidelines. After we hear from Representative Craig and Mr. Slavitt, our attendees will have a chance to ask Representative Craig or Mr. Slavitt questions. In order to keep this town hall productive and respectful, I'm sure we all agree that the questions should be written courteously. Tough questions are welcome, and they're good, but obscenity and insults are not allowed, and any questions with it will not be included. If you have any questions during the course of this town hall, please write them into the comment sections and they will be routed to me. We're very excited for this morning's event and we appreciate your interest in being here. With that, I will hand it off to Representative Craig to make her opening remarks and to lead us in the Pledge of Allegiance. Representative Craig.
Thank you so much, Earl, and thank you for being back with me here for my 19th town hall. Earl was my moderator in Northfield last year, and there's no better moderator than a middle school teacher, so thank you so much. I always start each of my town halls with two things every single time, and the first is to say thank you and honor our nation's veterans. It is certainly an honor to work on your behalf in our country. So a special honor to our nation's veterans. The second thing we always do is we say the pledge together. So please join me in saying the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, with indivisible and liberty for all. Thank you so much. I wanted to start today by saying I'm so honored to be joined today by Andy Slavitt. And to be frank with you, I'm a little off this morning simply because my friend, my colleague, John Lewis, died last evening. And so I just want to say that we lost a civil rights icon in this morning. We lost a colleague. We lost a friend. I lost someone that I walked across the Edmund Pettus Bridge with my family, and someone that I stood with, and this is the best way that we can honor him in our nation, someone that I stood with as we introduced H.R. 4, the restoration of the Voting Rights Act earlier this year. And so, John, God bless you, and for all of us, let's remember that liberty and justice for all means for all. And so let's continue his legacy of working together. The first update that I want to give you is that it has been a very, very busy last 3 weeks. I'm honored to be joined by Andy Slavitt. He's the acting director during 2015 to 2017 of the Medicare of CMS, Center for Medicare and Medicaid Services in our nation, and has a lot of experience and has been a leading voice for Americans during the COVID-19 fight. During the last several weeks, I want to start with just the numbers, because I think that will frame our conversation this morning. We have had now in the United States 3.3 million cases of COVID, approximately 135,000 confirmed deaths, over 44,000 confirmed cases. And in Minnesota, we have had those confirmed cases of 44,000 and over 1,500 confirmed deaths. We have to remember, first and foremost, that this is a healthcare crisis. Along with the public health crisis we find ourselves in, we also have a national unemployment of 11.1%. 51 million have filed unemployment claims. Those numbers, as we think about June, have in Minnesota have gone down just a little bit. We were at historic highs of almost 10% last month. Now we are at 8.6%. And at the end of the day, where we started in this nation in Minnesota as well was 2.9%. So unemployment continues to be a particular concern. The reason I always start with this is a healthcare and economic crisis is because the most important thing the Congress can do is make sure that we are investing in healthcare in our country right now. I continue to believe that this nation is without a federal strategy for its supply chain. The fact that our states and our restaurants and our public health facilities are still competing against one another for personal protective equipment that is now also in short supply again is a national tragedy. We need a strategy for testing, for contact tracing, for treatment, for our supply chains, for personal protective equipment, and we need the administration to enact the Defense Production Act. We need to invest in healthcare right now, and we also need to begin thinking about now investing in a vaccine, in R&D, the equitable distribution of that vaccine. We have a number of different companies around this country and around the world that are looking for that vaccine, but there is no guarantee that that vaccine will come from America. And so we need our world and our international partners. I also want to just mention that several weeks ago, as it relates to the economy, the House passed the HEROES Act. The Senate will be back in session next week, looking to start to negotiate for the next wave. But as we think about the unemployment insurance benefits expiring, as we think about the economic assistance to those who are facing their next mortgage or rent payment, as we think about the stress that's been put on our states, our cities, our counties. I know the first act of the money of the CARES Act is now going out. We need to make sure that we continue to support the hardest hit sectors of our economy, including restaurants and hospitality. And I have called for, and I was pleased to see the Secretary of Treasury, Steve Mnuchin, yesterday in one of my committees, the House Committee on Small Business, express openness to using the final $100 billion that has been appropriated as part of the Paycheck Protection Program for a second forgivable loan for those hardest hit industries like restaurants and hospitalities and hotels. I have introduced that bill in the Congress. It's called the Prioritized Paycheck Protection Program. And I do hope that that is part of the negotiation that is ongoing over the next several weeks. I'm back in DC for the next 2 weeks. There'll be massive discussions around appropriations bills as well as the National Defense Authorization. Some of my priorities for IDEA special education funding have made it into that bill, some of the language around lowering healthcare costs. So I look forward to a robust discussion in Washington. Over the last 3 weeks as well, I have been honored to have my second bill signed by the president into law. My bill in the House to extend the Paycheck Protection Program to August 8th was signed by the president. And I've been heartened that we met with some local community lenders this week who have expressed that very, very small businesses have come to them in the last couple of weeks with a request for very small loans like $6,000 and $9,000. And so I'm very pleased that that extension is going to good use. I also, in the last 3 weeks, have had HR 1425, the Patient Protection and Affordable Care Enhancement Act, passed by the House on a bipartisan basis. This was the base of the bill was my bill. that would lower premiums in the individual marketplace, that would expand Medicare to some of the states that have not expanded it. And it would also incorporate the Elijah Cummings Lower Healthcare Cost Now bill that would lower the cost of prescription drugs in our country. Finally, on the last couple of weeks, we've also seen a government accountability report that indicated that my first bill that was signed into law has helped the Treasury understand that they need to stop payments to deceased people as part of the economic stimulus program. Apparently, we've paid $1.3 billion in payments to deceased individuals. And so my bill that was signed by the president caused them to stop and say, we need to stop this. And they have now corrected that. Again, a lot of things are happening. We passed an infrastructure bill in the House. We passed the Water Resources Development Act. I've introduced 2 bills with my friend and colleague Pete Stauber from the 8th Congressional District, the Supporting Apprenticeship Colleges Act, the Stop Coronavirus Scams Act, and then finally, I introduced this past week the Ryan Fresconi Memorial Student Debt Relief Act. An Egan couple let me know that they're still paying 7 years after the death of their son Ryan on a student loan, a private student loan that they signed for, co-signed for, and I think that that is absolutely just wrong. So with that, I want to say that all of the conversations that we are going to have today with Andy Slavitt bring us back to this topic of, at the end of the day, we find ourselves in this nation in the middle of a public health crisis, and that this Congress has to remember that all of the economic stimulus that we are being required to pass on a bipartisan basis is really because of this economic healthcare crisis we find ourselves in. So with that, I'd like to welcome each of you to the 19th Town Hall. I'd also like to introduce my friend and just a really thought leader during this pandemic, Andy Slavitt.
Thank you, Congresswoman Craig. I live here about a mile or two from Congresswoman Craig's district. And I have to tell you that I'm jealous of all of you, not because I don't like and appreciate my own representative, but because the record that Congresswoman has established already has been remarkable. And I think about her words about Congressman Lewis, who many of us considered to be our teacher. And I think about the people who are going to carry on that legacy of fighting for people, of standing up and saying when something's wrong, of showing courage, and of getting stuff done. And I think that it will be a lot. There will be people who will be honoring his legacy, and I can't think of anybody other than more so than Congresswoman Craig to help carry on. So I've been spending a lot of my time looking at and working with various governors, with the Congress, some with the White House, scientists and others on what's going on and what's coming here. And I know it's a very difficult time for everybody. In one way or the other, people are fearful, people are uncertain about the future. There's a lot of anxiety, and there's a lot of sickness, and we've lost people, and we know that the worst isn't over. I think in some respects, this, along with the George Floyd murder, is in many ways a test for our country. It's a test for all of us. I really, when we said the pledge just now, and I spent some moments looking at the flag, was reeling through, I think my mind is, what is the potential of this country? What does this country mean? And what do we do in the face of crises like this? So it's a big personal test, no doubt for many of you. It's a national test. And, there are a few levels of this test where we haven't gotten off to a great start. You know, we didn't do a great job in preparation when the storm was coming. We haven't covered ourselves in glory in how we've responded. You know, it's one thing to miss it in March, but through April, May, and June, we have seen what's happened in New York and New Jersey, and we haven't adapted very well. We haven't learned the lessons. We still sit here today in July with a shortage of personal protective equipment, with a shortage of tests, an inability to see what's going on, and uncontrolled spreads in many parts of the country. So where are we, and what is there to expect? We're in what I call wave 1, phase 2. Wave 1 meaning we're still in the first wave of the virus sweeping the country. We've hit the phase 1. The phase 1 states have been largely in the Northeast, although they include also Michigan. The phase 2 states are in the South. And why did they come to the South? Why did the virus come to the South? Whose fault is it? Well, it's just the way the virus works. It's nobody's fault. The virus goes to the places it hasn't been before and spreads in the places where it has the most opportunity to spread. So it goes to where the next largest sets of cities are: Houston, Los Angeles, Atlanta, Miami. But it also goes where people have to be indoors because it spreads much more easily, and it passes much more easily when people are indoors. So think about the humidity of Houston, the heat of Phoenix. All of those things are primary factors. Now, what does that mean for us here in Minnesota? It means come fall and winter, we will be Phoenix. We will be Houston. We will be forced to stay indoors. Right now, we're getting outside more, so it's reducing the spread because we have that advantage. But it's not principally because we've done anything necessarily a whole lot better, a whole lot different than those states have. Now, those states have been late. Those states, the phase 2 states, were sadly late to figuring out and anticipating what they should do. I think they were in a bit of denial. And as a result, they didn't take actions until their hospitals started to fill up. And even then, they've been slow to act. But right now, those states are in a world of hurt. And I can tell you that they wish they would have taken actions a month or two earlier. And so I'm encouraging Governor Walz to be ahead of the curve, which I know is hard because that means acting before there's a crisis, which means that it's going to feel unnecessary to some people. But we don't want to be in the situation when it comes here, which is either in wave 1, phase 3 or wave 1, phase 4, where we have that situation. We have, I think there's a set of conversations around the country that are getting a little bit testy. One of them is around masks, whether they should be mandated or not, whether they help or not. And we can talk about that. I think the view is pretty clear that they absolutely do help. They reduce the death toll, and they are one of those things that may feel strange at first, but is really important. And if you have no other reason, it's many of us, some of us have the liberty of not having to go out very much. We have the liberty of picking and choosing who we're around, but a lot of people don't. A lot of you don't. A lot of you are essential workers, you're nurses, you're delivery people, you're working in stores, and you have to be confronted with people. And I wouldn't dream of going near somebody who has to be out right now and not do them the courtesy of wearing a mask. It's just, people who are essential workers are getting disproportionately sick. So where is there hope? Where's the light at the end of the tunnel? What's going to happen next? First of all, let me talk about science. So we're chasing an exponential disease. It's spreading rapidly. It's spreading in the community. We're not even able to measure it or control it. And so building factories and building PPE and all of these things has to be done, but it's going to be done at a marathon basis. The one thing that can catch up to the virus and also run exponentially is science. And there's a couple forms of science that we're looking at. One is better diagnostic testing, which I think will come later in the year, which will allow us to do much more testing more rapidly. The second are therapies. So one thing we can do, even if we don't make the disease any less infectious, is we can make it less lethal. And so there are several good drugs out now and several good trials. But the things that are principally you're at risk for if you get COVID-19 and you're in the hospital are blood clots, oxygen deprivation, or an overreaction in your immune system. The good news is, compared to where we were in New York, we now have limited drugs. We have some drugs that treat all three of those things. So the chances of you going to the hospital and coming back out are much, much greater than they were. Now, that's good news. And we get to keep going on that front. But we don't know what the long-term implications of the illness are. And we have early data which says that there are going to be long-term implications that are going to be perhaps similar to what they were with SARS-1, chronic fatigue, psychological complications, organ damage, etc. So it's not, we shouldn't just be measuring this disease in terms of how many people live or die. We should be trying to control the spread, because this is not something that we want people to have. Of course, the other reason for hope is until science, well, I should say that the third prong of science is vaccines. And I did an episode of our podcast, In the Bubble, which I encourage you to listen to if you want to know what's going on with vaccines, explained by two people who can talk about it in very simple terms, including one former head of the FDA. And they would both tell you, as most people would, that they're very impressed and optimistic with how quickly vaccines are developing and that the vaccine candidates are moving through the process. So that's great news. That means that there will be some weapons. But I want to explain that the difference between a vaccine the way I think it will happen and a vaccine the way people think about a vaccine. When people think about a vaccine, they think, after a vaccine, I'll be able to do blank again. Or we can do this until there's a vaccine. But the truth is that a vaccine will probably be more like the influenza vaccine than the MMR vaccine. In other words, it'll work in 40 to 50% of people, and it will be part of the weaponry that we use to combat the disease. And it may, in fact, lessen the symptoms as opposed to eliminate the symptoms for some people. It may work for some people better than others. And over time, there will be more and more vaccines. And so you can imagine a place a year or two from now when we have a number of vaccines, a number of therapies, testing everywhere, and the world gets gradually better and closer to back to normal, but not necessarily in one big step. That's probably the most likely scenario. And I think we owe a debt of gratitude to our scientists, and our scientists owe a debt of gratitude to you, because every day that we make the sacrifice of staying home, of wearing a mask, of not spreading the disease, it gives them another day. It gives them another day to work in the labs and get things done. And they're working very fast. So this has been very, very purposeful. Obviously, this is a marathon. Obviously, it requires extraordinary action. You know, we haven't seen this type of impact to our country since World War II. All of us get to be here and alive for this, which on the one hand is, of course, a challenge and a sacrifice. On the other hand, it is a chance to stand up and say, what are we as a country and as a people? Congress has to help. The HEROES Act passed by the House is a perfect example. When people ask me, should we help people with evictions? Should we help people with unemployment insurance? Should we help fund public health? Should we help fund more healthcare? Which of these things should we do? And my answer is, do all of them. Do all of them. You don't go through a crisis like this every year, and when you do, you leave it all on the field. We've got 0% interest rates. We've got the ability as a country to get ourselves out of this, and we need to have the backs of the people in this country. And that's why, thank God, we've got people like Congresswoman Craig. Finally, I'm just going to leave you with, I think, one final thought, and then I'm happy to answer questions if you have some. I think about often, what will we remember from this period of time? 10 years from now, 20 years from now, when our kids, our future grandkids, God willing, are telling us, asking us, hey, what was it like in 2020? And I'm thinking about, what will they be reading in the history books or Wikipedia or KitKat or TipTop or whatever app they read history from those days. And, I think there's going to be two things that are going to be sticking out. One is, how many people did we lose? We will remember how many people we lose. And I think to some extent that will be the judgment of this period of time. So are we doing everything we can to save every life we can, even when we're discouraged? The second is, who did we help? What were we doing, and who did we help in this process? You know, we've got neighbors, I'm sure you do too, who are lonely. We've got people who we know who have a lot of anxiety. We got people we know who are hurting financially. We've got 40 million people going to food banks. We've got a lot of, so any time that I feel like that we're in a position to help somebody, there's no better time. And I think we'll remember that as well. Now, I know we're obsessed with a lot of other issues that are important, like schools, like whether our bars and restaurants are open, et cetera, et cetera. You know, I don't know that we're going to remember those to quite the degree. I'm not suggesting they're not important or they don't have the impact, but I know that the school year is going to be clunky. We're not all going to get what we want. It's going to be, it just is what it is. We're in that period of time. And, you know, I tend to look at my kids and say, okay, if it can't be optimal for them at school, what other lessons can I make sure they're learning? What other things can they take away from this period of time? Not to try to make lemonade out of lemons so much as to understand that, you know, this is an extraordinary time. It's going to require us thinking differently than we thought it would be a few months ago. And, you know, that dealing with it that way, day by day, I think will help us all get through it and help all of our neighbors get through it. So that's all I've got for you.
Now we have questions for both of you. I'll identify who the question is for and then allow you to proceed. The first question is for Angie. What are your priorities for the COVID relief package coming out of Congress?
Well, thank you so much, Earl. That's a fantastic question. First and foremost, we need to continue to fund the public health aspects of this. So any dollars that we can get for a vaccine, for testing, for treatment, those are a huge priority. Beyond that, I think extension of the unemployment insurance benefits. I know there's some debate over whether that should be an extension of the $600, whether there should be more means testing associated with that. But, you know, what we're trying to accomplish here is to prevent the domino effect of a mortgage or a banking crisis as a result of people not paying their rent, not paying their mortgage. And then the final two things I'll mention is state, cities, and counties. I was really proud to see that 47 of my county commissioners and mayors signed on to a letter asking for additional assistance, because the next economic impact of this is really going to be felt at a state level. And Minnesota, I think the numbers are, Earl, that we get about the 7th highest in the country rate of return on our money we send to Washington. So from that perspective, Minnesota shouldn't be shortchanged at all. And we want to somehow prevent those education cuts, those transportation infrastructure cuts that we would see as a result of that. And then, you know, the final thing is I think we have to stay flexible on how we help those most hardest hit businesses, sectors like restaurants and the hospitality sector, retail sectors. And so I'll continue my focus on small business, but I'm hopeful that the Senate will be back, that Secretary Mnuchin will sit back down, and that many of the things we passed weeks ago in the HEROES Act will be taken into law here in the next couple of weeks.
Thank you. Our next question is for Andy. Andy, how effective is wearing a mask in reducing the spread of the coronavirus?
Good question, and I assume you want a scientific answer. So there's different types of masks. They're all effective, but they're each effective at slightly different things. If you wear a well-fitting mask with one-way protection, like a cotton mask or like a surgical mask, you will dramatically reduce the spread of to other people. If they're wearing a mask in return, you are both reducing the spread pretty significantly. They studied a whole bunch of counties that wore masks over the last 5 weeks. It was in April and May, and they analyzed that there were about 350,000 cases that were prevented. So those 350,000 cases, of course, also spread to other people. So they are effective. Over time, I introduced something with bill with Bernie Sanders, and we have an op-ed on it that's in CNN yesterday called Masks for All. And we're calling for the Defense Production Act to be enlisted to start making more masks. And over time, I think we're going to have better technology. We're going to have masks that are easier to fit. We're going to have masks that are washable and reusable without losing their charge and their effectiveness. And so I think things will get better and better and better. But at this point in time, I would say that the people most at risk are people who are essential workers, who are exposed to us on a frequent basis indoors, and we have to wear masks around them. We have to wear masks indoors. I suspect that will become the law here in Minnesota. But even if it doesn't, whether it does or doesn't, I think people need to understand it, and because nobody likes to be told what to do. And I would tell you that it's a very smart thing, and I wear a mask wherever I go.
Thank you. We have a participant, named Lucas, who has a question for Angie. He asks, what are you doing to make sure that people don't become overburdened with healthcare costs as a result from hospitalization from COVID-19?
Well, it's a great question, Lucas. Thank you so much for that. And I think it's a critical issue. In the original CARES package, we negotiated for free testing for everyone. And so it's very disturbing to see that folks are getting bills for tests. I would advocate for treatment for testing. Look, at the end of the day, what is happening here is we are asking everyone to stay safe. And when you think about if you're hospitalized with COVID-19 and you don't have access to health insurance, that's why I've been working so hard to lower the cost of healthcare in this country, to advocate for policies like a public option to compete with health insurance companies, to advocate so much for prescription drug costs to be negotiated by Medicare, which is currently absolutely enshrined into law as not a possibility, for that to extend to private health insurance plans as well, negotiated drug costs. So look, at the end of the day, I believe that to get to universal health care is going to require us to rethink our current healthcare system. It's going to require us to rethink the fee-for-service pay system that we currently have in this country. And so, I think during this public health crisis, we can't rely on access to health insurance. And post this crisis, we are going to have to dig in deeper and stop allowing politics to play a role in the cost of healthcare. I was proud in the last 3 weeks that my bill, H.R. 1425, passed the U.S. House of Representatives that would expand coverage to millions of additional Americans through the expansion of Medicare in those states, Medicaid in those states that didn't expand it to begin with, that would lower the cost of premiums in the individual marketplace, that would finally take on brand name drug companies in this country. That is a question, and I think that this pandemic has caused us really to step back and say whether our healthcare system is working and what we need to make sure we do to make sure that everyone has access to it.
Thank you. Our next question is for Andy. Karen is wondering, how do we counter the abundance of misinformation that is out there about the virus and the dangers it poses? She's asking this both from both a medical and government standpoint.
Yeah, it's a good question. And again, I hate to keep doing this, but we did a podcast episode called How to Talk to People in Your Lives about masks or social distancing who don't agree with you on In the Bubble. And it was fascinating because I came away from that understanding it very differently than I did going in. So, I mean, start with people that you know. One of the things that doesn't work is bullying, arguing, shaking your head at people, and getting angry. Because one of the things I try to start with is everybody is going through something difficult right now. And whether that difficulty is that they're scared for their health, whether that difficulty is they're scared for their job or their small business just closed, that's something that we have to listen to. And so if someone were to, confront me or give me something I didn't think was true, I'd say, help me understand where you're coming from and why you feel that way, and then tell them why I feel the way I do. And it actually helps to give people the agency to say, this is what I believe, and to acknowledge that that's reasonable, and to say, we're going through a hard time. Nobody knows all the answers. Science is evolving. It is confusing. And, giving people the benefit of the doubt and having a sense of empathy. And I would urge people not to let these disagreements destroy their personal relationships. I've got way too many letters and emails from people who are telling me that they're no longer speaking to their parents or their kids or what have you because of all of this strife. I think it's hard, but we have to step back and say, oddly enough, one of the ways to counter the misinformation is to sort of let the misinformation kind of stand out there, validate that it's fair for people to feel a certain way, and in a very calm way, tell people how we're feeling. Now, there's also purposeful misinformation, propaganda, that comes, as you pointed out in the question, from the government or other places. And I think, again, I think it's important to do it patiently, but it's also important to understand that most people in the country are taking this seriously. There is a vocal minority of people who don't take it seriously or who are belittling it or what have you. And it always seems like it's 50-50 because that's how the media portrays it. It's not. We've done a lot of polling, and I've seen a lot of polling. The vast majority of people are very much worried about getting sick, worried about getting through this, and the majority of people in most places will wear masks, will socially distance, etc. Not everybody, but it's never going to be everybody. So I think we, to some extent, maybe over worry a little bit about people who disagree with us, because we're never going to be able to control that. And yes, it influences the speed of us being able to deal with this crisis. If everybody took it seriously like other countries did, we would be where other countries are, no doubt about it. But I think it's gonna be, people are going to get there in stages, and some people aren't going to get there at all. And unfortunately, it's hard to deny the reality of what's happening. I spent time talking to Abbott and his team in Texas in May, and they didn't believe it. You listen to Abbott today in July, he's a different person. You can't possibly go through this and not be different about it. I talked to Governor Whitmer in Michigan, she's also on the podcast. She said she has 3 people in her family that died of COVID-19. And she said, you know what that experience is like? For anybody who hasn't gone through it, and I'm sad for anybody who has. She said they check into the hospital and you never see them again, ever. You don't visit them. You can't claim the body. And often there's not a real funeral. And she said, I've never felt anything like that. I've never seen anything like that. Lieutenant governor in Michigan has lost 21 people in his family. Get on the phone and talk to people in other states that haven't experienced this yet. They do hear this cognitive dissonance, and you can't wish that on anyone. But people are acting most people based on their experience. And for some people, they haven't had that experience that Governor Whitmer had. They may have had experience where they know people that have lost their jobs, and that's COVID-19 to them. And we have to be equally compassionate, I believe, for those people, because those are sad, difficult situations, certainly as well.
Thank you. Our next question comes from our guest, Sue. And the question is for both of you, but Angie, we'll start with you. Sue asks, what are your thoughts on reopening the economy while keeping us safe from the spread of COVID?
Well, thank you, Sue. It's such a great question. And, if you look at economists, what they say is if we would all just wear masks, we could probably add 5% to GDP growth. In other words, one of the most critical components to doing the things that we want to do is actually wearing masks to help prevent the spread of this virus. And so I think the economy opening is going to look different depending on the community you live in and the amount of community spread. It's going to depend, sadly, because we've devolved all of these responsibilities to each of the governors of our states. It's going to depend on the amount of community spread. It's going to depend on your testing capacity, how much contact tracing you're doing. It's going to depend on your hospital and hospital ICU capacity. So again, coming back to what Andy said in the beginning, this virus, if we're still in the first wave of this thing, but phase 2 of it, we have to be vigilant. We have to continue to work together, because I know the stress and anxiety in our business community is real. For many of these folks that I talk with on a daily and weekly basis, this is their American dream, and they're seeing it disappear as a result of this public health crisis. So if we want to open the economy, if we want even the possibility of getting some or all of our children back to schools, we've got to first and foremost treat this as the public health crisis that it is.
Thank you. Andy, would you like to add your thoughts on reopening the economy while keeping us safe from the spread of COVID?
Yeah, so am I on? Okay. Yeah, so we, a number of folks, Republicans and Democrats, and I authored a document called Open Safely. It's hashtag Open Safely. It's at open-safely.org. The president, and I don't want that to be too political, but I think it should be pretty clear, is hoping to run on improving. And there's a false assumption there, which is that the economy can come back while we have tens of thousands of cases every day, while we have people dying, and while we have people hospitalized. I don't think it can. I mean, it can limp along and get to a 75% or 80% of its potential. But think about the things that drive the economy. Number one, it's consumer spending money. So who's going to buy cars? Who's going to travel? Who's going to spend a lot of money and do the things that really drive the economy during this time? Number two, it's businesses. Who's going to sign long-term leases in buildings? Who's going to hire a lot of people? Who's going to make the kind of business expense until we know we've got this thing contained? We don't have to have it finished. We just have to have it contained. And the third, of course, is government. And that's what the job that Angie's doing. But I look around the world, okay? Take a list of countries: the Czech Republic, Greece, Italy, Germany, Vietnam, Singapore, Malaysia, Hong Kong, China, New Zealand, Australia. Every one of those countries has begun to open up their economy safely. Why? Because they did something we didn't do. They took what I call a hard reset. They took 2 to 3 weeks, and they basically said, we're going to take a little short-term pain in exchange for some long-term gain. And now they are much more robust and running their economy, and we are in this sort of limp along, halfway done, soft approach where we're trying to have the best of all worlds because we've been unwilling to make the hard, difficult shutdown choices. So, and those choices can vary. In some countries, it's been wearing a mask. In some countries, it's much more disciplined rules around social distancing. In some countries, it's an amazing amount of testing for everybody, including asymptomatic people. And you see what happens if you read the news in any one of these countries. If there's 20 or like, it's a crisis. Imagine we have 70,000 cases one day last week, yesterday or Thursday, and it wasn't a crisis. If you got, Japan had 65 cases one day, and it was like, and put people around it and made tough decisions. We haven't done that. I'll be honest with you. People, this may not be popular. We wouldn't have the bars open in this country right now if we cared enough about containing the virus and opening businesses. Yes, it would cause short-term pain for bar owners, indoor bars, I should say. But they would be open much more quickly. I would put to you, if we made some of the tough decisions earlier.
Thank you, Andy. The next question is for Angie. Siri asks, do you support withholding federal funding for schools if they don't start the year in the physical buildings? If not, are you willing to stand up to Secretary DeVos?
Well, Siri, thank you for that incredibly important question. The answer is short and simple. It's hell no. I won't support Secretary DeVos and her just ill-thought idea that somehow, well, first of all, if the federal government actually funded public schools the way they should, that threat would ring a little less hollow. But number two, our local school districts, our local taxes, obviously our state, that's where most of the funding for our public schools come from. Now, the caveat to that, and some of you would know this has been a huge priority for me, is that there is a percentage of funding for schools that really comes down to Title I funding. So those schools that need the money the most, who have often, the most Black and brown and indigenous students, they would be hurt the worst with this kind of threat by the federal government and the administration. IDEA funding, special ed funding, also has been a huge priority for me. That's an area where we should be ramping up our funding so that schools that end up with a hybrid approach toward learning or who end up in complete distance learning, depending on the amount of community spread, have more funds to be able to meet the IEPs of those special education students during a pandemic. And so the short answer to your question is no.
Thank you. Our next question is for Andy. Our guest Sue asks, with over 50 million people out of work and not paying Social Security and Medicare payroll taxes, would you comment on the financial stability of the Medicare program?
Yep. Yeah, thank you. Boy, it's a great question. It's probably one of the only questions that I've never gotten before. So you're a student of the Social Security and Medicare trust funds. I was a trustee for a period of time. So for those who don't know, there's a separate pool of money set aside in a trust for Social Security and for Medicare. And there are payroll taxes that fund this. Right now, I believe that there's funding in Medicare in both of them for a handful of years, and there's no doubt when the actuaries get together again next year, exactly as Sue said, there's going to be they're going to reduce their estimate for how long those will last. Now, I will just say something important. We're not in danger, and we won't be in danger of those funds running out, because there are a number of easy steps and some harder ones, but there's some easy steps that can be taken and that will be taken and always are taken when we run into that situation. And some of it has to do with the fact that we have pretty low inflation, which makes things a bit easier. Some of it has to do with how we, I think as Congresswoman Craig said, about how we pay for medical care and keep costs under control. But we are also underutilizing some of the tools that we have. For example, if you make above a certain level of income, as most of you know, you stop paying payroll taxes above much of your income. So very wealthy people pay very, very little in the way of payroll taxes, little relative to their earnings and their income. And that hasn't been tapped into. Eventually it will have to, because it is regressive. And, it won't take a lot for that to alter the situation. It won't be done until there is the need and the will. We don't act typically in this country unless there's a crisis. So I wouldn't worry about those funds, but I think it's a very astute observation.
Thank you, Andy. Our guest Leah has a question for Angie. Leah asks, How can businesses get support for maintaining their healthcare plans in the short term? And how do we reform healthcare in the long term so that my insurance doesn't rely on my job and reduce that financial burden on my employer?
Well, thank you so much, Leah. It's a really great question. And as part of the HEROES Act, one of the provisions we had in there was to help cover the cost of COBRA benefits for a period of time for those who have continued to be furloughed and unemployed in this nation. You know, the last thing we want during a pandemic is to have those that plus up completely eliminated, because then you're going to have people out looking for a job literally during a pandemic, or you're going to have folks who are coming off their health insurance during a pandemic. You know, I was really disappointed that the administration didn't reopen enrollment under the ACA as we found ourselves in this pandemic. I've repeatedly called for that while working on a bipartisan basis to reduce the cost of that in the open marketplace. You know, your broader question around healthcare reform is a great one. And, you know, one of the reasons why I don't support the bill, Medicare for All, is because it stands up a fee-for-service pay system in this country. And I know that, you know, some of my colleagues do, but I really believe that we need to move toward a value-based healthcare system, one where we pay to actually get people well, where we don't pay hospitals and physicians more for the more treatment that they provide to people. I want to pay them more for the less treatment because they got people well and they sent them home and they're out of the hospital. And I think we've seen during this pandemic this over-reliance on elective procedures in our nation for hospitals who have, you know, thin margins in some time periods. You've seen them, what happens when those elective procedures where that fee-for-service pay system is in place. So my vision for this healthcare system in the medium term is really, you know, let's stand up a public option that can compete with health insurance companies. Let's take on the pharmaceutical companies by requiring this country to negotiate with pharma companies for its Medicare and its Medicaid services. Let's also take on the extended patent protections in our nation that many of our pharma companies have for biologic drugs, for other drugs in this country that is far beyond what other nations have, which would increase generic competition in our nation. Look, I tend to believe that a system like Australia's system, where you have nonprofit health insurance companies, where there is a basic level of healthcare provided to every American. And then we still expect employers to cover in a nonprofit system some of the healthcare costs. But at the end of the day, we change how we pay for it. We've had a 10-year conversation in our nation about the cost of health insurance, but we haven't actually stood up to tackle the cost of healthcare yet.
Thank you. I would like to add a quick programming note. We're scheduled to finish at 10. We're going to go about 5 minutes later to get more questions in because we had a late start. Our next question is back to you, Andy. Our guest, Barry, asks, what expectations should we have for the success of a vaccine, such as timing, effectiveness, adoption, compliance, etc., and what implications will this have as we move toward 2021?
So there are right now about 7 or 8 good candidates in the U.S. The earliest two are Madeira and Oxford, which are going through phase 3 trials in July. The early data is promising, although I'd say not definitive yet. And so anything can happen. But the scientists that I've talked to that have looked at those data, and they're now enrolling people in both Brazil and the U.S. We'll have big trials in July. And if those people can be exposed to a lot of the virus, so that's one of the biggest time factors. Oddly enough, if we give this to 30,000 people and none of them are exposed to the virus, then it'll be harder to get data. But if they are exposed to we have a number of people exposed to the virus, so it's in hotspots like Miami and other places, then we could have a set of data as early as August, September. And a couple of things could happen. One is that in the fall, there could be an emergency use authorization that the FDA grants to say, hey, we have enough data. And the metric they're using to make this decision is 50%. Do 50% of people have, do we see that 50% of people have an improvement who take this drug? They're obviously, the other effect that they're looking for is to make sure there's no adverse events, adverse side effects, which on the one hand, so far it appears good. On the other hand, there hasn't been a ton of time. So if it gets approved early, my sense is that it could be for just target populations, like people who are frontline medical workers or others who are highly at risk. This Operation Warp Speed that the country is running now has us starting up manufacturing in parallel to the work on the drug, which means that if the drug doesn't work, you end up throwing out a lot of medicines. But it's a smart bet. It's a smart thing to do. I would suggest that it won't be until the middle of next year, some point, in the best case, if one of these drugs worked out, that we'll have a widely available vaccine. And if so, my expectation is 40 to 50% effectiveness. Could be wrong, could be better, but I think that's about where the first vaccine will come from. But it won't be the only vaccine. I think over the next few years, we'll then get more vaccines and better vaccines. And in combination with other things like convalescent plasma, which is something you give somebody right after they get infected, and it looks really, really promising, there'll be an arsenal of things that can be effective. And again, it will gradually reduce the risk over time. It won't make the risk disappear. It will be possible that there are certain populations that the vaccine won't work for. It is possible that the vaccine won't work as well on older people. It is possible that any one of a number of things can happen. And this is just, I would just encourage people not to get discouraged. This is just sort of step by step, sometimes 2 steps forward, 1 step back, the way science works. And there'll be ups and downs, but in general, in the main, I think we're going to see a lot better weapons that will reduce the risk.
Thank you, Andy. Our next question comes from our guest, Karen, and her question is for you, Angie. Karen asks, many cities, counties, the AMA, and now Minnesota is looking at declaring racism as a public health crisis. What are your views on this, and how should this impact future legislation?
Well, it's a great question, Karen, and this comes back to just all of the work that Congressman John Lewis has done over his life in this Congress and throughout his time with us. And, I've had over the course of the last couple of weeks 2 roundtables on systemic racism, because I do think after the murder of George Floyd, after the peaceful protests we saw, after the community outpouring from the 2nd District, that it's time we continue to have these open conversations. So one of my roundtables was on the topic of health disparities. After spending over 20 years working in healthcare and leading a health plan for the last 4 years, after serving on the Black Maternal Health Caucus of the U.S. Congress, and the facts that 3 to 4 times the rate of white women, Black women die after childbirth, all of these facts on health disparities, we've got to address this. And we're seeing this play out in the COVID-19 response as well across our nation. The other roundtable that I held was on home ownership levels, and just having folks in my district understand the history of discrimination in home ownership in our nation and how that has led to a gap in generational wealth between Black and white Americans. And so, look, we absolutely have to stand up and say, what are the federal policies that have and continue to cause systemic racism in this nation? And then finally, I'll end. There is there's no worse Supreme Court ruling than the Shelby ruling that took away the protections of the Voting Rights Act. And so, you know, standing on a stage with Congressman John Lewis as we introduced H.R. 4 in this Congress that would restore the Voting Rights Act, that would stop some of the voter suppression that we are seeing across our nation, to address systemic racism, to address healthcare, to address campaign finance reform, to address all of these issues. There is no greater right than the right to vote, and we need to make sure that that is protected.
Thank you. Don't go away, Angie. We have another question for you.
Excellent.
Stephanie is wondering if you could talk about the Ryan Fresconi bill a bit. Before you do, Stephanie has a comment. She says, I do not agree with it as I understand it. One person mentioned that parents could take out a life insurance policy on their children. I think that it would be far more fair than to leave a lender in the lurch. I am so sorry for the grief of this family and all others in this position, but I don't think that a blanket forgiveness is the right idea when families of entering college students could take out life insurance policies on their students to pay off such loans. Angie, could you respond to this suggestion about your recent bill?
Yeah, thank you so much, Stephanie. And thank you for being here and for disagreeing with me on a policy topic, because this is what these town halls are really designed to do, is to have open dialogue and, frankly, respectful disagreement. So the background of this bill, and it's tough to communicate in 10 seconds when you're doing a TV interview, is that the law was actually changed by the Republican-controlled Congress in 2018. What happened was any private loan acquired with a cosigner after 2018 will be forgiven. So those federal loans already, if you have a student who dies that you co-signed a loan for, the idea is on a compassionate basis. We don't want those parents to have to go sign a check every single month, mail it into a lender. And so when I heard the Fresconi story, when I heard them talk about their son, Ryan, and talk about the fact that he did have addiction issues, and but they thought he had finally sort of got himself on the right track. He was back in school. He had taken out a student loan. They gladly co-signed for it. 7 years after his death, because that 2018 law was not made retroactive, 7 years after his death, they still send a $200 check to his student loan lender every single month. And so most of these private lenders have compassionate review policies that would waive that, but about 20% of private lenders still, they're required now if someone dies at 2018 forward, but they don't have the policies of compassionate review. And since we've changed the law moving forward, Stephanie, it was my view that for the Fresconis, for all of those families who have to relive the trauma of losing their child every single month, and as a mother of 4 boys, I can't imagine what that would be like. I wanted to make this law that passed in 2018 retroactive. So again, thank you for asking me the question on a public policy basis. That was my thinking. You may still not agree with me on it, but I really respect you being here today and asking the hard questions.
Thank you. It's 10:07 right now. And before we sign off, I would like you to please indulge me a moment, as I would like to personally thank a few behind-the-scenes people. On behalf of Congresswoman Angie Craig, I'd like to thank Senior Community Liaison Morris Allen, Community Liaison Julia Bartusek, Communications Director Jen Gates, Staff Assistant Philip Shelley, and Executive Assistant to Andy Slavitt, Michaela Lim Honerbrink. Finally, on behalf of all of those who logged in this 19th Town Hall from Representative Craig, we would like to thank Angie and Andy for their time and thoughtful responses. Thank all of you for joining in, and we wish you a healthy and happy journey. Thank you very much. Goodbye.